We have Dr. Richard Besser, the acting head of the Centers for Disease Control from Washington, D.C., Dr. Julie Gerberding, former head of the CDC, and our own ABC News contributor from Atlanta, Dr. Tim Johnson. Great to have all three of you this morning.
Good morning.
All right, let's start with the obvious. Please, a show of hands if you are concerned that this is the big one. This is the big pandemic to be worried about. Any hands? No. Good. All right, then, Tim, let me come to you. You have been looking at the situation, all of the concern. What is the reality of the level of concern we should have?
Well, we should clearly be very concerned. The government scientists, the public health structure is very concerned. And so they put out the message to maintain their credibility of what could happen. The media transmits that message. That's our job, at least initially. And the public hears then sometimes many messages, as you point out, from different experts, often contradictory. They tend to, as a matter of survival instinct, I think, to believe the worst and prepare for the worst. My own personal opinion is that even if it goes to the level 6 pandemic, it will be based mostly on numbers and spread, not on severity of illness. So that I think is why none of us have yet at least put up our hands.
And part of the reason that we're saying words like mild and spreading slowly is what has been discerned in a genetic difference between this virus and the 1918 virus, right? Dr. Gerberding, what do we know about this? What is the difference?
Well, there are some genetic tests that have shown the virus we're dealing with right now does not have the factors that we think made the 1918 virus so bad. But we have to be careful not to over-rely on that kind of information because these flu viruses always evolve. What we see in a cross-sectional picture today still can change and get worse or better as the virus moves through the population.
All right, so if we're looking at it, wondering what's going on, we already know that the flu can take as many as 30,000 Americans every year. Dr. Besser, let me bring you in here. What makes this one different and special?
You know, this is a rapidly evolving situation with a lot of uncertainty. Whenever you have a new outbreak of a new infectious disease, you don't know how that's going to play out. And so it's extremely important that we take aggressive measures until we know what this is going to look like. And, you know, the concern and fears that are being expressed, we're trying to channel those into planning and action because people can do things to protect their health.
Such as?
Well, there are a number of things, and they're the simple things that we've been talking about day in, day out. Washing your hands frequently, and if you don't have access to soap and water, using alcohol gels, covering your cough with your sleeve, not your hand. And most importantly, if you have the flu or flu-like symptoms, you shouldn't go out in public areas. You shouldn't be traveling on planes. And I think the Vice President was expressing the concerns that so many people have in terms of how can I protect my health? And, you know, a clear message is if you have the flu or flu-like symptoms, you shouldn't be getting on an airplane or you shouldn't be getting in a subway. But for the general population, that's quite fine to do.
Now, a lot of people hear this advice, wash your hands, don't go out if you're sick, and they dismiss it as trivial. So, Tim, you know, when we're hearing this, it's saying, well, if it were so bad, they wouldn't just be telling us to wash our hands. What should you know?
Those activities that Dr. Besser just described are absolutely essential to helping prevent the spread. If everyone practiced just those three things, hand washing, avoiding somebody who's sick, coughing into your sleeve, it would go a long way, a tremendous way toward cutting down the spread. So these are not at all trivial. They are, in my judgment, as important as what medical science can do.
Is there any reason to suspect right now that we have an expectancy here about what's going to happen? How many people could be infected? How long will this last? I mean, as simple a question as, will we be talking about this in July? Dr. Gerberding, what do you think?
Well, there are some pieces of information we just don't have right now. And so I agree completely with Dr. Besser that we need to be leaning forward on this. We need to know the 3 S's. Are we generally susceptible to this across the board? Is it spreading fast in the kinds of environments that we typically expect to see flu spread? And most importantly, how severe will it ultimately prove to be? If we knew the susceptibility, the spread, and the severity, we could look into a crystal ball and at least make some predictions about what might happen. But right now, we don't have those information pieces, and we've just got to err on the side of caution and continue to be vigilant and do the things that we believe will help slow down spread and hopefully protect the most number of people for the longest period of time until we have a vaccine or other interventions that can be applied.
Well, a couple other quick points. The other S here is schools. I mean, people are closing schools all over the place, even when they don't have a case. I mean, Dr. Besser, is that the right way to be cautious?
Well, our recommendations right now are if you have a case in the school, you dismiss the students until you've been able to sort out the situation and ensure that there's not ongoing transmission. We're seeing some different things taking place in different communities, and that has to do with, I think, a couple factors. One is different comfort levels with a disease in the community and different local situations. And it's very important that these decisions be local decisions based on the best available guidance from experts in dealing with these problems.
All right. Thank you very much to all three of you, Dr. Besser, Dr. Gerberding, and, of course, Dr. Tim. Appreciate the information this morning.
Thank you.
Thank you.